You are most welcome, friends, to academia, and we want to look at surgery. May 2019, one word. Okay, you can invite more, and thank you so much for supporting us as the team. Let's continue. The first question says a strand of material used for opposing tissue together is called a strand of material used for opposing tissue together is called. So it's important that we understand the question before we give the answer. Now, when you analyze properly this particular question, okay, it has got one, a strand, two, this is a strand of material which we use to oppose, okay, opposing tissue together, meaning bringing tissue together, is called, definitely the answer is going to be suture. Okay, suture. Now, a suture is just a stitch made to join together. So opposing, this word you see here, means joining together. Okay, join together. So a suture by definition is just a stitch made to join together the open parts of a wound, especially when one made after a patient has been operated. Are we together? So that is the answer to question 71. All right, let's continue. 72. The question says the inflammation of the gums is called, look at this word, inflammation. The inflammation of the gums is called gingivitis. This one is actually well known. It's called gingivitis. It is also called gum inflammation. Okay, it is also called gum inflammation. Now, a form of gum disease that causes inflamed gums, that is called gingivitis. Basically, this is well known. Remember, the other name for gingivitis, it is also called gum inflammation. You can also write that. So the cause is actually poor oral hygiene, untreated, gingivitis. Remember that it can lead to tooth loss and other serious conditions. Are we together there? So gingivitis is a common and mild form of a gum disease that basically causes irritation, redness, and swelling of your gums. Okay, that is what we mean by the inflammation of the gums called gingivitis. Are we together? Let's continue. 73, the question says an incision into the urinary bladder. An incision into the urinary bladder to drain urine from the bladder is called. Okay, understand the question. It is important that we understand the question. So when we understand the question, trust me, we will definitely answer this particular question respectively. All right, let's read together. Let us read it together. It says an incision into the urinary bladder to drain. Okay, an incision into the urinary bladder to drain urine from the bladder is called. So the answer, according to the nature of the question, it is called cystostomy. Okay, cystostomy. That is the answer. Okay, this is also called suprapubic. suprapubic cystostomy. That is the other pronunciation. You can also call it as, suprapubic, catheter, which is surgically created connection between the urinary bladder and the skin used to drain urine from the bladder in individuals with obstruction of normal urinary flow. Are we together? So the connection does not go through the abdominal cavity. That is what you must know. Now, what is the purpose of this surgery? Okay, so cystostomy is just a general term for the surgical creation of an opening into the bladder. It may be a planned component of, some urologic surgery or some kind of an occurrence. That is what you must know. So basically, remember that suprapubic cystostomy, this is the other name for cystostomy. Most of the times we actually give it halfway. So basically that is the answer, and some minimal explanation we can render on 73. I'm sure we are clear there. Okay, we go to question 74. Under question 74, the question says, when continuous bladder drainage is needed, okay? Look at the question. It says, when continuous, you forgive me, my voice is not really okay. I've been, teaching since morning, so it really sounds horsey. Let's continue. 74, it says, when continuous bladder drainage is needed and a catheter is inserted and stays in the bladder by means of self-retaining balloon, this is called what? So in other words, what they are just asking you is, what is catheterization? Okay, what is catheterization? That is a definition. So what is catheterization in essence? Basically, catheterization is just a procedure used to drain the bladder and collect urine through a flexible tube called a catheter. So a continuous bladder drainage, a continuous bladder drainage is needed, and the catheter is inserted and stays in the bladder by means of a self-retaining, self-keeping balloon is called what? Catheterization. That is basically the answer. Now, listen, urinary catheterization is just a procedure used to drain the bladder and collect urine. So through a flexible tube called a catheter. So a catheter is just a tube which is being inserted. Okay, are we there? We go to 75. Okay, 75. 75, the question says, excuse me, I'm feeling choky. The incision of choice for an appendectomy is the, let's consider this question. It says, the incision of choice for an appendectomy is the, now let me explain something here. If you remember about Mark Burney point is a point which lies 1/3 of distance along imaginary line between right anterior superior iliac spine, which is called ascus, and umbilicus. So the incision is made through this point perpendicular to this line called McBurney or MacArthur. That is how others they may call it, or even horizontally, which is a lance incision extended to about 3 to 5 centimeters along skin, creases. So now when you look at this question, it says an incision of choice for an appendectomy. Here is the condition. I mean, actually not the condition, but yeah, there is a condition now, the surgery. okay, the removal of the appendix. So they are now saying an incision, okay, so connect this to that. So the question says an incision, rather the incision of choice for an appendectomy is called what? The answer is going to be McPenny, okay, McPenny. 76. DASH is the most common renal cancer that develop in the renal cortex. That is self-explanatory. Okay, it is called renal cell carcinoma. Renal cell carcinoma. That is the name. Renal cell carcinoma. Are we together there? Remember, DASH is the most common renal cancer that develop in the renal cortex. Renal cortex. Now, renal cell carcinoma, the renal cell carcinoma, we can define it as also a type of kidney cancer that starts in the lining of small tubes in the kidney. So the renal cell carcinoma is most common in older men, okay, very older men. Risk factors, they include cigarette smoking and obesity mostly. Okay, so the other name for renal cell carcinoma, you may also call it as hypernephroma. Hypernephroma, you can call it that way if you would want. You can put hypernephroma here, or you can also put renal cell carcinoma, which is the most common renal cancer that develops in the renal cortex. Are we together? Now, when you go to 77, the question says DASH is a cancer of the kidneys that typically, sorry friends. Let me explain this. The answer that I've given, yes, it is for, yeah, that is okay, very okay. I thought maybe I've interchanged the questions. Okay, let's continue. Yes, so 76, we said the answer is renal cell carcinoma, and I gave an explanation. Now, 77, the question reads to say, 77, the question says, DASH is a cancer of the kidneys that typically occurs in children, all right? DASH is a cancer that typically occurs in children. The answer, it is called Wilms tumor. Okay, Wilms tumor. This is a rare kidney cancer that mainly affects children, also known as nephroblastoma. You can also call it that way, Wilms tumor. You can call it also as nephroblastoma. It is the most common cancer of the kidneys in children. So Wilms tumor most often affects children of ages 3 to 4, and it becomes much less common after the age of 5, but it can affect older children and even adults. Okay, yes, we go to 78. DASH, this is a delivery of radiation therapy through internal implants. This is self-explanatory, friends. So 78, the question is going to be brachytherapy. Brachytherapy, that is the answer to 78 dash. This is a delivery of radiation therapy through internal implants. The answer is going to be brachytherapy. It's self-explanatory. 79, the dash is a biconvex transparent disc made of proteins called crystallines, and it is located directly behind the iris and focuses light onto the retina. Definitely the answer is the lens here. Okay, that is the lens. Okay, so the answer is gonna be the lens. Question 80, it says dash is a condition in which the eye does not focus light. Now look at this. Here is the eye. Okay, here is the eye which does not focus light. Which does not focus light. What do we call this condition when the eye fails to focus light? What is the name of the condition? This is how the question is phrased. So dash is a condition in which the eye does not focus light. The answer is going to be astigmatization. Astigmatization. That is basically the answer thereof. Are we together? We carry on. 81. I've just jumped some questions. We really have jumped there. So we go to 81. 81, which is reading as dash is an age-related condition in which the ability to focus up close become more difficulty. Okay, more difficulty. Now, let us read the question again and again. It says dash is an age-related condition. Okay, an age-related condition in which the ability to focus up close becomes more difficult. Now, when you look at this particular age-related condition, its name, you can also call it as age-related far-sightedness. Okay, age-related far-sightedness, which is also called presbyopia or presbyopia. That is the other name. You can call it as age-related far-sightedness or presbyopia, which is an age-related condition in which the ability to focus up close become more difficult, like that. So the far-sightedness usually becomes noticeable in the early to mid 40s and worsens until around the age of 65. Are we together? That is how we can actually explain this particular question. I'm sure we are together, friends. Okay. Now, the other question says, which is question 82, scrub nurses are also known as what? Okay, scrub nurses, they are also known as what? Normally, these are called surgical nurse. Okay, they are called surgical nurse. Scrub nurses are also known as surgical nurse. So a surgical nurse, also referred to as the theater nurse or a scrub nurse, specializes in preoperative care. These guys, right? They specialize in preoperative care, providing care to patients before, during, and after surgery. So to become a theater nurse, register. Okay, nurses or enrolling nurses must complete extra training, like we are doing it. So that is it. Remember, they have got three names: scrub nurses, theater nurses, or theater nurse or scrub nurse. You can call them as that, or surgical nurse. It's very okay. 83 says the dash observes for breaches in surgical sepsis and coordinates the needs of the surgical team. Okay, so that is 83, which says the dash observes for breaches in surgical asepsis and coordinates the needs of the surgical team. That is 83. That is circulating nurse or a runner. Okay, or a runner. 84. The question says the treatment of prostate cancer using medicines in order to adjust testosterone hormone level. This is a hormone level is called hormonal therapy. Basically, it's called hormonal therapy. 85. The procedure of blocking the production of testosterone hormone by use of drugs like Zoladex is called. That is called. That's gone. The procedure of blocking the production of testosterone by use of drugs like Zoladex, it's called anti-androgen. Okay, anti-androgen. androgen deprivation therapy. If I'm not mistaken, you know, I stand to be corrected there. Okay, I stand to be corrected, but I'm sure this is the correct way. I stand to be corrected. Okay, we go to 86. It says a medical personnel who is specialized in the treatment of cancer is called, this is self-explanatory, friends. A medical personnel who is specialized in the treatment of cancers is called the oncologist. Mwame 9. Mquai. We carry on. Dash is the formation. Dash is the formation. Okay, dash is the formation of stones or calculi within the gallbladder or biliary duct system. That is the question. Okay, that is basically the question. So the question says dash is the formation of stones within the gallbladder or biliary duct system. It's called choledocholelithiasis. This is the presence of at least one gallstone in the common bile duct. Okay, so the stone may be made up of bile pigments or calcium or cholesterol salts. The liver produces bile, which helps in digestion of fats and so on. Remember those things and so on. Then we go to 88, which says a skin care around the cystostomy tube is critical in order to prevent what? That is infection, definitely. To prevent infection. To prevent infection. That is the answer. We carry on. 91. The question says dash is the condition. 91. Yeah, we jumped some questions there. I'm able to see. Dash is the condition. Okay, let's continue. Dash is the condition. Dash is the condition is due to an abnormal proliferation of mesenchyme elements in the bone marrow, spleen, liver, and lymph nodes. Okay. According to the question, look at this. This is a condition which is due to abnormal proliferation of the elements, especially in the bone marrow, spleen, liver, and lymph nodes. Definitely, this is called leukemia. Aye, that is called leukemia. Okay. 92. Dash is a condition that results when thyroid tissues are stimulated by excessive thyroid hormones. Look at this. There is what is called it's called what? Thyrotoxicosis, yeah, and the hyperthyroidism. Now, in this case, you should be able to know the difference between the two. It's very important. So in this case, 92, it says dash is a condition that results when thyroid tissues are stimulated. Look at this. Thyroid tissue are stimulated by excessive thyroid hormones. So the answer is gonna be hyper, because that is excessive, meaning high. Okay, so hyperthyroidism, that is called hyperthyroidism. Okay, you can comment there, but basically that is the answer. Let's continue. 93. Dash reconstructive surgery of a joint or joints to restore motion because of ankylosis or trauma, or to prevent excessive motion. Dash. That is called what? Arthroplasty. Yes, arthroplasty construction. You just repair. Carry on. That is called the arthroplasty, which is the reconstructive surgery of a joint or joints to restore motion because of ankylosis or trauma, to prevent excessive motion, and so on and so forth. Are we there? All right, let's continue. We go to question 94. A dash is an injury to the soft tissue around a joint. soft tissue injury. That is as a soft tissue injury. These I'm not explaining because they are direct. They're just direct like that. So 95, a fracture that occurs in an area of a diseased bone tissue is called what? What do we call that fracture? That is called, let me read again. It says a fracture that occurs in an area of a diseased bone tissue is called, that is called pathological fracture. Right? Yes, pathological fracture. 96, the type of forceps. Okay, the type of forceps that must be available during intubation is called, that is Maggio, catheter forceps. A process of supporting respiration by manual or mechanical, means of normal breathing is insufficient or has stopped is known as, that is mechanical ventilation. This is just some way of supporting and so on. The other name for CDEX is glutaraldehyde, which is CDEX. So they are just looking for the other name, which is called glutaraldehyde, and so on. 99. The third structure to be incised before viewing the abdominal cavity is known as, that is called fascia. Okay, fascia or fascia. 100. An increase in the number of cells of a tissue, most often associated with periods of rapid body growth. We call that as hyperplasia. And we end here. Thank you so much, friends. Learn one or two things. You can post how you've understood the questions. For more explanation, you can join our WhatsApp group. Today I'm feeling tired and I've just considered these particular questions. So if you want to contribute, you can comment over and contact us. Thank you so much, friends. God richly bless you, and we love you as academia people. Thank you.